So we just completed a build for a client of ours, and they are in the home health industry. And essentially, what that means is, as somebody checks out of a hospital and needs some home health care, this company is hired to help take care of them, whether it's daily or weekly, with a lot of different types of services that they offer there. But with that comes a lot of pain of scheduling, tracking where their different people are. There's also continuous hiring to make sure that they have enough people in the different areas. They're covering two different cities, so they need to make sure that they're tracking things there. This is only a team of three people in office. And so they really needed a system that would help them organize kind of the day to day tasks, as well as what's going on with incoming new patients and tracking all of those caregivers that are going to be going out and making sure that basically everything is staying balanced in the middle of all of this chaos. And so they reached out to us and we helped build them an amazing Monday.com build that really checks all of those different boxes and has helped save them a lot of time and is helping them organize things. They're now in the middle of a move, but they keep telling us how great this build has been for them. And today I want to kind of jump in and show you what we built for them. All of this is inside of our system now, so all test data, but we can give you a good idea of how you can take Monday.com to establish an amazing work system for a company such as this in the home health industry. Awesome. So let's go through the different boards that we built for these guys. Some of them are very basic. Other ones have a little bit of explanation to it. So clients essentially are going to be the active patients after they've been onboarded. So in the medical field, you definitely need your own EHR that's going to be keeping track of all of the different medical records and things like that. But from just kind of managing almost like equivalent to a CRM, they wanted to keep that inside of Monday. They have an enterprise system that is encrypted, so everything is HIPAA compliant. But essentially, on the active clients list here, we have typical information of like their name, phone number, location, things like that. And what helps them out is, let's just put in a test client here. We'll put in two different test clients. And then we have their scheduling, contacts, comments, basically just fields that they needed to keep track of. But the big one here is that we have two separate locations. And what we do is when we look at client by location, we can essentially see the division of their different clients. And this really leans into hiring, which I'll look at here in a second. But they're looking at two cities. And so they select this from a drop down, and then they can keep track of kind of what the demographics are spread across those two cities. And then if they do need to reach out, they've got phone numbers and things like that here. So very basic board there. On the intake side, the way that this workflow works is essentially somebody is checking out of a hospital or a facility and they get the contact information of our client and they reach out and basically say, hey, my mother just checked out of a specialty clinic and I need somebody to take care of her 3 days a week. And so the first step of that is an intake. And so we keep track of all of that. We have a form tied to it, which is great. So that way we can go vertically and just type in all the quick information. So we're on a phone call, we're typing in who's in charge of it, knowing if they have long-term care insurance, some notes, the referral source. We might also have the phone number and the email and stuff on there. And when that's entered, it goes in incoming, and the goal is that we will schedule an intake for maybe next week. And so when we track that, we'll be able to look at different things like intakes this month. So we can kind of keep track of what that number is. That leads to business. So it's essentially equivalent to the same thing as like number of leads in a given month. Follow up this week. So after we schedule an intake, we want to make sure that we follow up with them the next day so we can schedule follow up days. And then we can also do tasks for those people. So we enter them in here, then we need to enter them into an EHR and maybe do follow-up reach out, thing like that. So that is actually ties over to our task tracker. And so this is just a very traditional task tracker. You could even just type in follow up on here, and then you would tie this over to a patient. This right now is tied over to our intake board. So if we had somebody over there, that would be tied over. And so that way we can tie tasks either to a patient, or we can just say, hey, we need to do payroll this week. So very basic task tracker here. But it does allow us to sign this out so people on the team, when they log in the morning, they understand exactly what they need to work on. We can set due dates, all the typical things that are kind of Monday out of the box. On the other side of this, we have applicant tracking. And so in this world, there is turnover. Also, as they scale, they need to make sure that they have enough caregivers to take care of the population and all of their clients. And so they're constantly going through different applications, and they do this through Indeed, but they need to track after a certain point, after they've read the resume and they're ready to schedule an interview, they track all of that over here. And so we might schedule an interview date here for the future, add some notes of like seems really good for whatever, for a particular type of care, or maybe wants to work Monday, Wednesday, Friday mornings. This is a big deal too because a lot of their caregivers are working part-time, so they do not only do they hire them, but they got to make sure that they can fit them kind of where they need to be. And then here's the location and region again. And this basically, as we look at our applicants, we want to make sure that we're hiring in the same locations as what our demand is. So, and sometimes one location or region needs more patient care, so we're going to hire more there. We want to make sure that we're kind of keeping that balanced. We have the phone hired date if we want to keep track of that, and then the hired date allows us to build dashboards or understand like how many people have we hired this week. So as we set goals and realize like, hey, we need to hire 10 people next month, by tracking the hire date, that allows us to understand how many applicants have gone through. We can understand how many were not hired. There is a lot of systems, honestly, to the hiring process of things, more from just tracking how many applicants you have coming in, how many are being hired, how many are not hiring, to kind of understand what your throughput is, to realize that if I need to hire 15 people next month, how many applicants do I need to accept? How many interviews do I need to schedule in order to get to that 15? Maybe it's 25 and only 10 don't get hired, or maybe we need to go through 50 applicants in order to hit that 15 hiring rate. And so these numbers can start showing us what that actual metrics are, so we're not playing a guessing game. So this is really powerful here. And also we understand that this is going to be increased payroll. So this helps us understand that, hey, we just hired 15 people. We're also going to be onboarding them in the next month, and we're also going to be having an increase in payroll in the next month. So having this applicant board is just a very simple way to track and make sure that I show up to the interview as a hiring manager next week, but also understanding and keeping track so we know where they're going. So we don't have to keep track of all of this in different places than a spreadsheet or anything like that. WellSky is their EHR of choice. And essentially, unfortunately, in WellSky, they don't have a great way to export data, or they don't have any way to integrate that data. But they do have a way to run reports. And so what we built here for them is essentially kind of a scorecard. And so they want to track what they scheduled at the beginning of the week versus what actually happened by the end of the week. So maybe at the beginning of the week, they had 1,500 hours scheduled, but by the end, 10 of those fell off and they have 1,490. Their number of clients might change over the week. Staff hopefully doesn't change too much over the week. Number of open visits, canceled visits. Some of those might not have, obviously you don't have scheduled canceled visits, but at the end of the week, you might have 20 canceled. How many intakes you have scheduled for the week. This kind of comes back from that intake board. And then how many patients are we discharging, or essentially kind of like ending their care because they no longer need our services. So this right now is manual entry, but we are working on building something where with AI, which is really cool, where they take a PDF that has a report of each person's hours, and then they can upload that into a Google Drive, and then AI reads that and then ports the numbers over to here, which is really cool. But right now, on a Sunday or Monday morning, we enter in the scheduled hours, and then afterwards, we type in the actual hours. And so what that does is when we go over and look at monthly or weekly tracking, we can look at in October, for monthly clients, we had 50 scheduled, but we only ended up with 45 at the end. We had, this is for month by month of monthly clients. When we look at monthly hours, we can look at the different months. If we go to weekly tracking, pretty much the same thing. We just look over like the past few weeks. So we can look like, this is old test data, but essentially the week of September 29th, we've got originally 50 and 45, 50 and 45. A lot of this is duplicated data, but you can see here that we have a widget for every one of those metrics, and we can look at it compared scheduled versus actual side by side for each week. And this is showing, really starting to show trends and baselines for them. And we can even add, if we wanted to, if our goal is to have 10 intakes, Monday allows you to add those baselines in there so we can see kind of what the goal is. On the caregiver side, this is the staff. So all this really is the person's name, if they're active or not, phone, location, and so forth. And then this leans over right now. This just shows us the divide. Again, so this is how many caregivers we have on staff today. We can see that we have more staff right now in Bernie. And then hopefully I emptied out the client board, but if we have a list of clients and we know what their locations are, these closely match each other. If we had a lot more San Antonio clients than Bernie, then we need to start going hiring some more San Antonio caregivers so we can support the clients. Same thing on intake. If we have 25 intakes in the next couple weeks, we can kind of see where those locations are, and that starts giving us a little bit of a forecast into our hiring and understanding that. And then we also have the staff hours to understand, is everybody at max capacity, or can our caregivers do our caregivers have room to work a couple more hours a week, and then we can separate out clients that way. And then finally on the tracking board, this just kind of brings everything together. We've got the main task tracker for all team members. So that way, if we have a weekly meeting, we can meet all of those. On the My Tasks side, this would just be the person logged in sees those. And then intakes by month, we don't have any numbers in there right now. But essentially, this is bringing all of the important metrics to a single location dashboard. So that way we can talk about it during our weekly or monthly meetings to understand, hey, we have 35 intakes coming up this month, or we've completed 25 intakes this month, things like that. And I kind of copied this over before we finished the entire build. But the goal with this dashboard is making sure that we don't have to go to 5 different locations to get the right metrics, that we can put everything together in one spot. So the most important information is there. So we can make decisions on if we need to adjust anything or not. And we can also see if we're starting to fall off track. And so I had a lot of fun building this. Our client is really happy. They only have 2 or 3 people in the office with those 60 caregivers. So it's very chaotic to manage all of this. And so Monday.com was a perfect solution for them to track all of this. They still use their EHR for all of the actual caregiving for their patients, but they needed to understand more of what's happening inside of the business so they can make adjustments and continue to scale. They are a growing business, and if they did not get these systems in place, then it's going to create more pain points, and potentially they would be hitting a ceiling of how far they can scale because everything kind of gets lost in the weeds. And so with a Monday.com project like this, it really helps them organize their day-to-day work. They can see what's going on, see where they need adjustments, and then hire when needed, or make adjustments as needed. So if you are working with a team and you have a lot going on in your business, and you want to see if we could build out a Monday.com project for you, book a call with us. Go to theoptimizationspecialist.com/call. Just enter in a little bit of details. Honestly, it's a very low pressure call. We want to see if we can help you. I have a lot of passion in this. We really enjoy helping business owners start to grow their business and work on their business instead of inside of it. As a business owner, we start these businesses to create a better lifestyle for ourselves, but in many cases, we get stuck in that trap of basically just building maybe a higher paying job, but definitely a harder working job, and we don't get that time to enjoy what we are looking for. So if that sounds like you and you're looking for a way to get your team organized and you want to continue scaling your business without all the headaches, reach out to us. Would love to see what you have going in your workflows and see if a project management system like Monday.com or ClickUp would work for you.